Hi everyone, Assalamu alaikum. Welcome back to another episode of Being a Sickle Cell Warrior. My name is Aisha Magaji, and you can call me Nana Magaji or the Sickle Cell Voice. In today's episode, I would like to talk about discrimination and stigmatization sickle cell warriors go through in every phase of their life. First, before we go right into the episode, I would like to talk of something, which is there is this time people normally call us or refer us to as sicklers. You see that word sicklers? It's a form of stigmatization. Sorry to say that. It's a form of stigmatization. We assume it that way. It is a derogatory term. The right word to use for any sickle cell patient is not sickler, rather call the person a sickle cell warrior. Yes, we are warriors, not sicklers. So calling us sicklers, babu daddy. So we prefer to be called warriors, call us warriors, because we are actually warriors or even legends. If you know the amount of pain and things we are absorbing, you definitely refer us to as well. So please dan Allah mu aji wannan kalma na sikla in a gefe, mun bar shi tun zamanin kaka da kakanni. So now we prefer you guys should call us warriors. Ku kira mu sickle cell warriors, not sicklers dan Allah. Thank you. For stigmatization da nake so na yi magana shine it's in every phase of life na sickle cell patients, tun kama daga tasowa as yaro to age na adolescence har kuma zuwa adulthood. One of the biggest issue we are having is I will start advising our parents. What I normally say is, dan Allah parents, iyayenmu, if your child is attending a school, be it Western school, Boko, Islamia, ko church Bible school, get a medical report indicating that your ward is a sickle cell patient, ɗanka sickle cell warrior ne, ka kai musu wannan makarantan. The essence of doing that is yaro yana da ƙiriniya. Normally, as kana girma as yaro kana da ƙiriniya, za ka yi wasan ƙwallo, za ka yi ball, za ka yi waye da ƙawayenka, but then baka da lafiya, you are not, baka da isasshen lafiya, baka da ƙarfi da za ka yi activities in ko kuma wata ran ma punishment. If you get a medical report ka kai makaranta, it will be like I informing school authority that your so kid is having an illness, your so kid is a sickle cell patient, so they will know the kind of punishment da za su bashi ko kuma extracurricular activities da ya kamata su yi engaging yin shi a ciki. Kar a zo a bashi punishment da ya fi karfin shi ya zo ya triggering crisis, ko kuma a yi engaging in shi activities in the body system nashi ba zai yi handling ba. Because the truth of the matter is we are not as powerful as other people can be. Our immune system is compromised. So kamar yanzu mai asma ne, in ka sa shi yayi shara and you know ƙura zai iya triggering shi attack nashi. So it's the same thing for a sickle cell patient. So I always advise, be it Islamia ko Boko ko church, take it and inform them that your child is suffering from this illness, so at least they will know how to handle him and the sort of activities they will engage him in. The second thing is our parent as well. I'm saying this to our parent as well. There is no point in hiding to the world that where your child is a sickle cell patient, especially for mu mata, mu warriors mata. Like I get some of our parents, they fear that way as you grow older, you're going to marry, ka iso marriageable age, or your suitors, when they learn that you are battling with sickle cell anemia, they might run. To su tafi mana sai menene? Me son ka in bai so ka, mutum in zai so ka so ka tsakani da Allah. It shouldn't be like saboda okay in me shi dama ya zo okay ya ga ba zai iya ba, fine and good ya tafi. There is no point in hiding it sai an zo kuma daga baya. Me shi okay an yi auren, then he went and find out that you are a sickle cell patient kuma ya ga ba zai iya handling ba, sai a sako muku yarku ta dawo gida. So me aka yi kenan, an yi ba a yi ba kenan, abin da kuka gujewa in gashi nan ya faru. But since the very first day, okay, what's your genotype? My genotype is this, my genotype is that. If the person sees zai iya auren yarku a haka ko ɗanku a haka, fine and good. in kuma ya ga ba zai iya ba yayi gaba, Allah zai kawo mata mafi alkhairi. So there is no need to rush any girl in the name of marriage or be hiding it a community. Ai kar community ko makota su san cewa she's suffering from wannan. In an ce sickle cell ne sai a ce no aljanu ne, because you know some people refer to sickle cell as aljanu. It is a spiritual problem, and I totally understand why they do that, because okay, 1 minute you are with a person, the person is totally fine, he is good, he's everything, and the next minute the person will be sick. Second, then she had dabuche and his mood has changed and he have started crying. Maybe my pain in came in its full force, like severe crisis, ba ma mild crisis ya fara. So people normally regard it to ce aljanu ne wai ko or banji, something like that. But the truth of the matter is not spiritual problem by aljanu bane, rather it is something in our gene. So haka shi ciwon yake, 1 minute you're okay and the next minute kuma everything can change, you will be sick. So they will keep telling I aljanu ne tunda okay aljanu wannan is nothing a big deal to some people, so they prefer to say it that way, ana kokoyewa kar makota su sani, or maybe let not the people in the community, so that maybe an zo bincike let them not say oh she's a sickle cell patient. Please and please, we need to stop. This is 2025. You have to stop this. There is no point pushing your daughter or taking your daughters where they are not wanted or they won't be valued. Gwanda ta ci gaba da zaman miki a gida, kina ganin ta cikin ƙoshin lafiya, rather than to take her to a place whereby they won't value her ko kuma a ta tsangwamanta ana nuna mata kyama. Then for also the boys, a lot of our young guys who are sickle cell warriors as well, they get this stigmatization from in an zo suma magana a way you see okay sickle cell comes with many complications, different complications, and for the guys they mostly have AVN. AVN is a short form of avascular necrosis, whereby femoral head, it can be hand and it can be shoulder, and it can be the leg, whereby femoral bone in yana gogan juna, and due to lack of proper oxygen flow and blood flow, it will be that bone in ya fara cinyewa to the extent that the person will start limping because the femoral health has been disrupted, ya riga ya kankare, so gap in da zai yi creating sai jawo mutum yana limping. It mostly happen a lot, and leg ulcer. Leg ulcer, it's kind of ciwo ne mutum zaka gani kaman ciwo, ya ji ciwo na shikenan sai kaga an yi wata 6, wata 3, shekara 1, 2 ciwo ya ki ci ya ki cinyewa ya ki warkewa yana nan a ɗanye. So they also get stigmatized for that. Oh, ai kafan shi ɗaya ki ɗaya tsayi, no, oh yana limping, they will not. So there is no point is doing that. It's not a permanent disability. It's something that will be corrected and can be corrected. Just that it's expensive. But there is many a ciki kowa da yanda Allah ya halitta shi. Wani tun day one Allah haka ya halitto shi ya fito babu kafa ko ba ido ko ba kunne ba. Wani kuma along the line ne. So ba a gama maka halitta har sai ran da ka mutu. You might be born with your 2 legs, 2 ears, 2 eyes, nose, mouth, and the next day you might lose them. So Allah babu yanda ba a yi. So there is no point in stigmatizing a person for it. So one of the main stigmatization, if you remove marriage, is when it comes to schools. There are some schools whereby some teachers, so let's say teachers or lecturers, in the sense that okay, you have presented that medical report to the school telling them this is what your child is suffering with. So there are these particular teachers that see it where okay, I won't give him a special treatment. Who said you are giving him a special treatment? It is not a special treatment, rather you are being empathic. You are being empathic. We don't like sympathy, rather be empathic. Show that person an empathy, in the sense that you are feeling his pain. Imagine what he's going through. Imagine what he's feeling. So maka the person is this, you say okay, you will not tolerate it, you will not give the person special treatment, but special treatment bane, rather empathy ne. And so sai kaga a zo at the end of the day an kai medical report, but then that same person is suffering, getting what is not supposed to be done, getting punishments that warrant his body system not to. So bai kamata ba, ya kamata at least kai ma you are a human. It can be you, it can be your daughters, it can be your brothers, it can be your nieces, nephews, it can be your grandchildren. So show empathy to that person. saboda Allah ya ɗaura mishi this particular illness doesn't mean that, oh, me, she is a weak. No, we are not weak. The truth of the matter is sometimes we're even stronger than those of you who aren't sick or who aren't having any chronic illness. So chronic illness doesn't mean one is weak. I know a lot of sickle cell warriors that if you see them, about sickle cell patients, when if you see the kind of activities they are doing, because they normally tag us as weak people liability. They see us as a liability. Mutum zai je shi neman aiki, you go to the interview, you have ACT, you have pass it, your certificates, everything is intact. But when you present a medical certificate of fitness and they see you're a sickle cell patient, they automatically reject you. Why? Why is this happening? Why? Because they believe sickle cell warriors are liability. Since okay, we can be fine today and the next morning we are sick, so they see us as a liability. Wannan liability ne, za ta zo ta kawai ta in ta ɓata kuɗi ina jinyanta ne ko kuma she won't be coming to work. No, empathy in nan a nan ne yake shigowa. That empathy we keep talking about ba. We don't want sympathy, show us empathy. Just imagine, it can be you, Kaima. It can be you, Kaima, with asthma or any other illness. Sickle cell anemia is not an STI. It is not a sexually transmitted infection. It is not gonorrhea. It is not syphilis or any trichomoniasis. So why will you be showing that kind of stigmatization or discrimination, showing enemy to a sickle cell patient? Oh, to shi mai asma shi ma ba ciwo bane yanzu nan zai iya samun attack, shi ma it will lead him to the ER and getting an oxygen. So why is it always different with a sickle cell patient? Why? There is no point. Okay, if the person has the qualification and he has the experience, the skills you want, hire him and show him the empathy. On days where he is sick, give him a leave, or he will take off. So there is no point. Okay, I won't hire him. At the end of the day, when we come and we are sick, we don't have anyone to lay our heads on or shoulder or pockets to pay our drugs. You say, oh, that's why you see 1 or 2 sickle cell patients running around suna yin bara saboda menene an ƙi ɗaukan su aiki, and they have to fend for themselves. And one thing I will of sickle cell patients, wallahi, they are not, majority of the sickle cell patients, wallahi, they are having financial constraint. They cannot take care of themselves. This folic acid that we take daily and paludrin, a lot of them cannot afford it. Folic acid container, it comes in 1,000 tablets, 1,000. How many days do we have in a? It's about 365 ko 66 days ko 55 I can't see for sure. So it's about that. If you split 1,000 into doses, the one bottle of folic acid that is being sold for 1,000, 2,000 naira, it will last you for 3 years or more. But then somebody cannot afford it to be taking it daily. To tell you the kind of financial constraint a lot of physical cell warriors are going through. Sometimes a person will be sick and it is you that they will call, okay, that Allah, a critical cell patient that is brought in, they cannot afford the drug, they cannot pay the price of buying drug or blood transfusion. So that's because the person doesn't have anything to do and you're not hiring him. Instead of hiring him and showing him empathy, you're sending him away by using his illness as an excuse that maybe he cannot work, he will be a liability for you. It can be you or anybody in your family tomorrow. But mama adore, but that's the truth of the matter. Also, our youth, youth of nowadays, that's lovey, it's always lovey. You don't care about genotype also. Any face date, whenever the first date question you should ask is what's your genotype. Ask your partner what's his genotype. In kika ga alamun kina son shi ko kai ka ga alamun ta maka and this might be something you want, ask the person what's your genotype. There is no point in going into a relationship for 5 years, 3 years, 10 years, and at the end of the day sai an zo an sa date in aure. When you're about to present genotype certificate, then you see that both of you are carriers, you are AS and AS. You have spent a lot of years back when again you cannot split, but that you're but you might die if you do that. Don't you think about the pain you're going to cause an innocent human being, an innocent child da bai ma zo duniya ba amma fara maganar shi ba, but due to your own greediness and selfishness, you decide to kai kawai ka yadda you take it. Let me tell you, especially you ku mata in, kun ga shi namiji he's entitled to 4, like 4, we all know he's entitled to 4. Yawa, okay, zai ce okay shi ma ba zai iya rabuwa babu ke ba. He'll come and marry you. At the end of the day, ke ce za a zo a bari ya ɗawainiyan gidan. You are the one that is going to be left out. You are the one that's going to be left out to do all the hospital wahala, the burhaha, ke ce kullum in and out of the hospital with that child. She the only thing in kin samu mai tausayi and mai tsoron Allah, he's going to pay for the medical bills and hospital bills. Idan kika zo kika samu mara tsoron Allah ma, ke ne zaki nemo hospital bills in, ke ne zaki nemo abinci, you be the one to fend for that child, and at the end of the day you go and marry the extra 3 wife he's allowed to. Ke an yi fakin ɗinki a gefe, ke kina can kina kula da mara lafiya in and out. But shi kuma ya yi progressing, he has moved on with his life with 3 wives. Ke kuma you don't have that right to do that. You are not allowed to do that. So it's always come back to we, the women, whatever happened in that relationship, whatever the result of your greediness or selfishness, it will always come back to you, the lady, the mother, the woman. That's why we always advise women. You should be at the forefront first when it comes to maganar gender. Wallahi shi ba ruwan shi, in ka samu mai imani fa shi ne zai biya kuɗin asibiti, but in ka samu mara imani, you be the one to pay for the hospital bills. Love doesn't want it when your child has to bear the pain of your greediness and selfishness. Why will you bring in a child with sickle cell anemia? We are in 2025 and the pain is not bearable. It's not something you can bear. I keep saying we are not just warriors but legends because the amount of pain. Ask medical doctors, they cannot quantify the amount of pain sickle cell patients go through. They only assume. They normally say that giving birth is one of the most severe and excruciating pain. Ba aihuwa. If you know any, we have a lot of sickle cell ladies who have gotten married and they have given birth to 2, 3, 4, 5, 6 children. If you ask them to choose between sickle cell crisis and child labor, wallahi lazim, they will tell you that they prefer to give birth 3 times than to have a single sickle cell crisis. Just imagine mutum ya gwammace ya aihu sau 3 da a ce ciwon sickle cell ya tashi mishi. So to tell you that, okay, an ce aihuwa ya fi komi wahala. So this set of women that are sickle cell patients and kuma they have experienced giving birth, sun ce su they prefer to give birth 3 times than a ce sickle cell crisis ya tashi. To tell you the level of the pain cannot be described. Sometimes you say it's like you are being electrified, ko kuma ana yayyanka ka while you are alive, gunduwa and pieces in hannunka into 50 pieces while you are still alive. So to tell you the level of the pain, please, parents, the public, schools, our Islamic centers, our church, our religious centers, please, we need to do better. And even organizations, be it public or private, when it comes to recruitment, give that sickle cell patients a chance. Majority of sickle cell warriors, wallahi, are very, very intelligent. But then you have denied them their right to be hired or to work because you feel that person is having a medical challenge. Give them. There are many jobs sickle cell warriors can do. I personally am a baker, I'm a chef, I'm a civil servant. I was once a teacher, I'm a content creator, I'm a digital marketer. I'm into product photography, videography, I'm into many things. And nothing has stopped me. And I was never weak to pursue my dreams. So give the sickle cell patients chance. Give them. When you give them, that's when you know their capacity and you'll be able to work and fend for themselves. I would like to stop here in this episode. See you next time in our next episode. Bye. Don't forget the drill. Don't forget to like, share, comment, subscribe, and follow my socials. Thank you. Peace out.